this podcast will be on air into the African states, African countries, Asian, and even in United States. I just want you to tell that what are the main and the basic challenges you faced when you moved to the United States from Cameroon?
When I moved to United States 20 years ago, it's different from now. By then, you have a lot of Africans everywhere. So when I came, I lived in a little town called Abilene, Texas. I've been in Texas from my life. I've been to different states, like for work or school. But Texas is my base. I love Texas, precisely Dallas.
Dr. Nelson, I have noticed one thing that you're having a lot of knowledge regarding your field. So, do you study on the daily basis? Do you do the self-study or research, or is it about your networking? What's that? What's the secret of it?
Personally, I've learned so many things in school, and any doctorate degree, you have to study hard. A lot of research work I've done in the past. Also, with day-to-day activities I'm seeing every day, with patients I consult every day, and some studies, sometimes I also listen to podcasts or journals, I just glance on them. So again, this is a combination of factors that I'm putting together to express what is going on in the mental health field. So experience is a knowledge that you cannot get anywhere.
All right, viewers, this is Adnan Anwar, your host again with you with our new guest is Dr. Nelson here, okay? And Dr. Nelson from Texas. So, how you doing, Dr. Nelson? And thank you very much for, finding out time to be the part of this podcast.
Hi, Mr. Anwar. Thank you. It's my pleasure being here with you guys today. And
Mm-hmm.
hopefully, we're going to have a great podcast today. Thank
Ah,
you.
great. Okay, so who is my hero today? Who is Dr. Nelson? Tell me something about you, your origin.
Dr. Nelson is originally from Africa,
Uh-huh.
precisely Central Africa, Cameroon,
Right.
the southern part of Cameroon.
Okay.
I came to United States about 20
Mm-hmm.
years ago.
Mm-hmm.
Since then, United States has been a home for me.
Right. So, do you live along with your family here?
Yeah, when I came to United States, I came by myself. Then later on, my wife
Mm-hmm.
joined me, and
Mm-hmm.
I'm married with two kids. So we've
Okay.
been here for quite some time now, and life is okay. It's all right. It's going good.
All right. So, actually, Dr. Nelson, that's this podcast will be on air into the African states, African countries, Asian, and even in United States. So, I just want you to tell that what are the main and the basic challenges you faced when you moved to the United States from Cameroon.
When I moved to United States 20 years ago, it's
Mm-hmm.
different from now. By then, you have
Oh,
a lot of Africans everywhere. So when I
all
came,
right.
I lived in a little town called Abilene, Texas. I've been in Texas
All
from
right.
my life. I've been
Okay.
to different states, like for work or school, but
All
Texas
right.
is my base. I love Texas, precisely Dallas.
All
And in
right.
Abilene, which is a county or country, they call it America,
Mm-hmm.
right? It's like a
Right.
little, where I come from, call it a village. And
Okay.
it was challenging because over there have a lot of old folks. Uh,
Okay.
it's good for retirement. It's a retirement city, old folks, and most of the people they were white Texans. People from Texas called Texans.
All
And
right.
you know, some challenges I faced during then was issue of accent. They'll be like, "Where are you from? You have an accent, and your accent is unique." I'm like, "Okay," but
Uh-huh.
sometimes they'll be like, "I don't understand when you're
Mm-hmm.
talking. You speak too fast,
Okay.
or they don't understand." Some will
All
be
right.
like, "Where you come from?
Mm-hmm.
Do they speak English? Where do you live? People
Okay.
live in trees?" I was like, "Oh, what world are we
Okay.
in? This is United States of America. They don't know
Mm-hmm.
little, or they know about Africa."
Okay.
So that was
So,
a challenge I faced. It
what?
was kind of like language barrier sometimes, or your accent. But overall, the people in Texas, in Abilene, are extremely welcoming and loving people.
Great. So, what is your native language? What is your first language in Cameroon?
Well, my first language in Cameroon is English. I grew up in English,
It's English.
but we have
Okay, so
another form of English that we call broke English, which is called pidgin.
all right. So how many languages can you speak at the moment?
At the moment, I can speak basically I'm Polish with one, which is English.
Okay.
Yeah, and pidgin English. French is my
All right.
second language. I used to speak French,
Mm-hmm.
but I don't speak French anymore. Being in the United
Mm-hmm.
States for too long, I think I've lost my French vocabulary.
All right. So did you complete your elementary schooling from Cameroon, Africa?
Yes, before coming to United States, I've already been college level.
All right. So did you used to be a good student or an average student at the time?
I was above average students because my
Mm-hmm.
grades were always between A's and B's.
Oh,
Most of it
great.
A's.
All right. Okay. So, apart from the challenges, I just want to know that uh, right now you are, you are a doctor. You are a finest healthcare provider in the United States. So, what are the challenges? I mean, you face to become a healthcare provider.
Before becoming a doctor, there are some challenges you face, mostly school in
Mm-hmm.
America.
Mm-hmm.
I would like to put on the record that the joining was not smooth. It's been
Mm-hmm.
some bumps, ups and downs. I
Mm-hmm.
started my career as a
All
CNA.
right.
From CNA, I migrated to become an RVN.
Mm-hmm.
Just transition from CNA, which is, to RVN, there are some challenges. You have to go to college. You have to take some classes. You have to have sleepless night.
Mm-hmm.
Uh, as an LVN, I went
Mm-hmm.
to school for my
All right.
bachelor's,
All right.
UTA, Arlington, Texas. That's where I got my bachelor's from.
Mm-hmm.
Bachelor's in nursing or bachelor's in science, specialty nursing. Uh,
Right.
from then, I moved further to get
Mm-hmm.
my master's again, MSN, in
All right.
master's in nursing with specialty in mental health. So
Great.
it's been a long journey to get to where I am, and it took me over. I've been in the healthcare industry for about 15 years.
Oh,
So
great.
if you look where I start when I started the joining till now, it's about 15 years,
All
and
right. So are you a healthcare provider by choice or by chance?
it's not by choice; it's by passion.
Oh,
It's
great.
something I have passion
Uh-huh.
for, and that is
Mm-hmm.
why I decided to go get a terminal degree in the nursing
Mm-hmm.
aspect, which is doctorate. And
Okay.
with my doctorate degree, my specialty is
Mm-hmm.
mental health because when I was working at JPS Hospital about 10 years ago, I
All right.
realized there's a huge need for mental health providers. People
Mm-hmm.
come into the hospital, most of them
All
don't have
right.
help or get them discharged to the community. They don't have access to health care with their mental health. So it was
Right.
challenging, and that's some of the things that makes me to become, a doctor in the mental health area, specialty in mental
So,
health,
well,
psychiatry.
so what do you think? What's your opinion about it? About being a mental health care provider in the United States? It's an easy job or is a hard job or what's that?
Where there's nothing like easy job in the United States. It's challenging, it's
All
difficult
right.
because being a provider, you have to make decisions for patients based on
Mm,
their sign and symptoms or diagnosis. And every
right.
other patient is different and unique.
Okay.
So you treat people differently based on what they present to you and how they perceive things and their level of understanding.
All right. Okay. So why have you chosen to become a mental health care provider? Why not others like primary care provider or something else in the healthcare industry?
Yeah, I choose mental health because something like I said, I have passion for it, and
Mm-hmm.
there was a huge gap I have a long history working with mental
Mm-hmm.
health patients as compared to my uh, family side medicine experience.
Mm-hmm.
I have more
All right.
experience, more vast and knowledge in mental health as compared to the
Mm-hmm.
family side of nursing.
All right. Okay. So, by the way, the mental health care providers also needs to take care of their mental health.
Yes, yes, that's great question.
So,
Very great question.
how do you do that actually? How
Yeah,
do you do that for yourself?
for me, I
Uh huh.
like to
Yes.
exercise. I
Mm-hmm.
like to go out, spend time with my like a hobby, and
Mm-hmm.
I've learned
Mm-hmm.
not to let people problems get into me. I listen, I
Mm-hmm.
come with a diagnosis and treatment, but I don't take things home with me. I have a
All
great
right.
family life, work balance life with
Mm-hmm.
great support system. My wife is my great support system and my kids.
Mm-hmm.
So
Great.
again,
So it means you spend time with your family as well, right?
yes, I spend a lot of time with my family. We have family times a lot.
Great. Okay. So how do you deal with the challenges and the problems of life? Because sometimes if you talk about me, so if I see that the problem, I can't find the solution for that. So I sometimes I eat a lot or I sleep for longer hours to divert my mind from the problem and then make a strategy and then come back. So what is your strategy of dealing with the problems?
Now, when we talk about dealing with problems in life,
Uh-huh.
everybody's life has some challenges.
Exactly.
It's just how you go about it and how you perceive things and how you deal with things in life.
All right.
Everything comes up is like, growing up, I have learned that there are things you have control and there are things you
Hmm.
don't have control over. What I have
Okay.
control over, I manage it rightly. What I have control over, I let it be.
Hmm. Okay.
For example, if someone is dying, I
Okay.
cannot change that. That's destiny. That's a calling from God. But
Exactly.
if someone needs food, what I can do, I can provide them food. So that is
Uh-huh.
how I try to navigate my day-to-day challenges. What I have
Hmm.
control over, I'll handle it.
Hmm.
What I don't worry about it. I let natural cause play parts.
All right. So what are the basic mental health problem in the United States these days?
There is no basic mental health problem across the board,
Hmm.
everywhere in the world.
Hmm.
People perceive things differently, and
Uh-huh.
everybody has some form of anxiety.
All right.
Nowadays, we're seeing a lot of spark in ADHD in adults across the board.
Hmm.
I've seen people in my own African community.
And adults at what age do you say? I'm sorry to interrupt you out.
I said
Um,
adult age, like, in older
uh-huh.
age, people in the 30s, 40, 50,
Hmm.
60, they've been
Okay.
diagnosed now more with ADHD as
Hmm.
compared to five,
Hmm.
10 years ago.
All right. Okay. So, and what are the reasons behind that? What are the main reasons?
I think the reason behind that from research is that most people were not seeking mental health care back
Ah,
20
right.
years ago as compared to today. Today, a lot of
Hmm.
people there's an awareness and there's still need for awareness for people to be aware about mental health. So
All right.
the lot, the more we talk about mental health, the more people seek help with their mental health. So the
Right.
awareness is very important for the
So,
community.
so is there any initiative has been taken by American government or a Texas government?
There's a lot of things going on within the United States where I'm based in. Most
Hmm.
of the times you see commercial, even on TikTok, people comes out and talk about their struggles. So the
Hmm.
awareness is going, and I
Hmm.
think doing podcasts like this is some of the things that's going to help some other people come out from their shelf.
Of course.
Back in the days, people see mental health as a stigma. I don't think mental health is a stigma. Mental health to me It's
Mm-hmm.
considered like any other medical conditions. Let's talk
Mm-hmm.
about diabetes or hypertension. If you don't take care of your diabetes or you don't take care of your hypertension, it's going to lead you
Mm-hmm.
to death. So, if you have a depression or having an anxiety or having ADHD, is it okay to be on medication and some form of therapy? Yes.
Right.
Is it okay for you to take medication throughout your life? Yes, because people with hypertension or diabetes
Mm-hmm.
take medication throughout their life. Now, there are some things you can do in people with hypertension or diabetes, lifestyle
Mm-hmm.
changes, the same thing with
Mm-hmm.
mental health. Lifestyle changes and therapy can improve your mental health conditions greatly.
Okay, what are the basic changes you recommend to your patients regarding lifestyle changes? And what are the things you suggest or recommend your patient to adopt in their lifestyle?
I would recommend good rest, exercise,
Okay.
and work life balance schedule.
Okay, so there are many theories of regarding good rest. There's some theory says that the 5 to 7 hours of sleeping is better. Some says, I mean, 8 hours at least sleeping is good. So what do you suggest? I mean, or it
I
depends.
would
I
suggest,
mean,
with my
every
experience
individual.
and doing this for over half a decade,
Mm-hmm.
um, I would suggest 7 to 9 hours of sleep a day,
Mm-hmm.
30 minutes to 45, 30 minutes to 50 minutes, 30 minutes to 60 minutes exercise 4 times a day.
Uh-huh. Screen time, I'm talking about the mobile phone. I mean, there are a lot of the adults and teenagers, their mobile screen time is more than 5 to 6 hours. So does it really affect to our mental health as well?
There's still a lot of research going on that. Yes, I'll say yes, from what I'm saying. If you're spending too
Mm-hmm.
much time on screen, like screwing your phone, spend time on your phone, you got you
Mm-hmm.
distracted, you can't focus, you can't concentrate, you end up missing
Okay.
obligations. So yes, too much screen time can affect your outcomes on a
All
daily
right,
basis.
Dr. Nelson, I have noticed one thing that you're having a lot of knowledge regarding your field. So, do you study on the daily basis? I mean, do you do the self study or research, or is it about your networking? What's that? What's the secret of it?
Personally, I've learned so many things in school, and any doctorate degree, you have to study hard and
Mm-hmm.
a lot of research work I've done in the past. And also with day-to-day activities I'm seeing every day, with patients I consult every day, and some
Mm-hmm.
studies sometimes also listen to podcasts or journals. I just glance on them. So again,
Mm-hmm.
this is a combination of factors that
All
I'm
right.
putting together
Mm-hmm.
to express what is going on in the mental health field. So experience is a knowledge that you cannot get anywhere.
All right. So as I told you before, that this podcast will be on air into the United States as well. So there are many healthcare providers who wants to start their own practice, own business. So and at the moment you're operating, you're running the finest business with the name of Regency Psychiatry. So what are the steps for any newly graduated healthcare providers to start their own practice or own business? What are the steps you recommend?
Great questions. I'm going to say, as a new grad out of school,
Mm-hmm.
don't think opening a practice is a good thing for you. It's my honest
Oh,
opinion. I will
right.
encourage anybody, even if brother or sister, to work
Mm-hmm.
and get experience and face some challenges at least 2 or at least 3 years.
Okay.
Then you can think about having a private practice. Private practice
All
does not
right.
only come with challenges, but also comes
Mm-hmm.
also with pay cut.
All right.
And running your own practice without experience is a risk for failure. And
All
if you want
right.
to do private practice, make sure you work in a private settings for
Mm-hmm.
some couple of years. Yeah, like again, I have a vast knowledge. I've worked long-term care and I've worked
Mm-hmm.
outpatient clinic before decided to go solo on my own practice. That is my honest opinion. Everybody has their own opinion and their own support
Mm-hmm.
system.
So it means that if even you have 1 lakh dollars, you shouldn't start without getting experience, right?
Yes, experience again speak volumes.
All right. Okay. So, by the way, do you provide mentoring to the newly graduated healthcare providers?
Yes, I'm affiliated with a lot of some different university as of moment.
Mm-hmm.
We offer
Great.
preceptor, preceptorship programs,
Uh, all right.
um, also mentorship for new
Mm-hmm.
grads that are trying to
All
get
right.
hands-on. We provide that as
Uh-huh.
well,
All
and
right.
I'll be more than happy for anybody that want help or struggle with
Okay.
any mental health conditions across
All right.
lifespan can contact my office, Regency
Mm-hmm.
Psychiatric Services, and
Mm-hmm.
our telephone number again is 469 four nine
Mm-hmm.
zero 1505.
Great. And where are you based in Texas? At what location?
Yeah, our office is main primary office is in Texas.
Mm-hmm.
Precisely, address
Mm-hmm.
is 1801 Gateway
Right.
Boulevard, Suite 209,
Right.
Richardson, Texas 75080. We also
Mm-hmm.
service people in Arizona.
Mm-hmm.
I'm also licensed in Arizona. I'm also licensed in Washington State. I am also licensed in Nevada. In those
Great.
areas, we also offer telehealth sessions.
Mm-hmm.
And also, at Regent Psychiatric Services, we have some good therapies. We offer
Mm-hmm.
CBT therapy, EMDR
Mm-hmm.
therapy,
Mm-hmm.
and DBT therapy,
Right.
etc.
Okay, so I think today's podcast is really valuable and the worthy podcast for all the newly healthcare graduated, as well as the patients, the people who are are facing with any kind of the mental health issues. So I especially recommend. I usually talk many healthcare providers because this is my job. So I really recommend that Dr. Nelson. I mean, you can talk to him and his team is really polite and kind. I mean, once you just approach him, you'll see the benefit about in your health, in your mental health actually. All right. So, Dr. Nelson, it was really great podcast, and I thank you very much for finding out some time for for being the part of this podcast. Actually, you know what? I would like to have another podcast with you regarding the learning more about mental health and the entrepreneurship from you if you can find some time in future.
Thank you, Mr. Awa, for creating this time for us to do this. But I also want to
Mm-hmm.
reiterate that at Regency Psychiatric Services,
Mm-hmm.
we are open from
Great.
10 to 5:30. Last consultation is 5:30.
Mm-hmm.
And we open Monday through Fridays, Saturdays, therapy sessions only. We treat
All right.
varieties of mental health conditions,
Mm-hmm.
anxiety, panic disorder, OCD, PTSD,
Mm-hmm.
depression, or OCD, PTSD, bipolar disorder, ADHD, borderline
Mm-hmm.
personality disorder,
Right.
and whatever you think you're going through, you
Great.
addictions, medicine also, we do some addictions,
Mm-hmm.
and any form of mental health conditions,
Mm-hmm.
autism, kids, and
Right.
we'll be more than happy to help you any of those conditions.
Great. Great. But Dr. Nelson, it has been seen that many mental health patients they avoid to consult with a provider because just they feel shy or something. So, what advice would you give to them?
My advice to some patient that are scared to go talk to a provider. Every
Mm-hmm.
provider is different. Here at Regency Psychiatric Services, we
Mm-hmm.
welcome all of our patients. We treat you with
Mm-hmm.
dignity and respect, and making
All right.
sure your
Mm-hmm.
whatever information we share with us is keep private. We are 100%
Of
HIPAA
course.
compliance, and we
Great.
are very
Mm-hmm.
welcoming from front desk. We have a great staff at the front, Miss Giovanna Garcia, and then
Mm-hmm.
at the back you have I and other providers, and some
Mm-hmm.
therapies. We spending our time, we've trained ourselves, spending our time over years to
Mm-hmm.
have this calm, warm, receptive method for our patients.
Mm-hmm.
We listen
Mm-hmm.
to you and
Right.
make the necessary appropriate diagnosis. If you are
Mm-hmm.
for medication management, we offer that. If you want therapy, we offer that. Anything that we can do based on the outcome of your evaluation,
Great.
we can help you with
Great.
that.
Great. Thank you very much for your time. I really enjoyed today's podcast, Dr. Nelson, honestly speaking. Now, from my viewers, if I can have, more than 20 likes on this video, then we'll definitely go for the next virtual podcast with Dr. Nelson. Okay. And in that podcast, I would love to have some questions if you would have that. So you can just send on the Aspire channel, okay, in the comment, and we'll ask from Dr. Nelson in our next podcast with this. So thank you very much, Dr. Nelson. It was really, pleasure talking with you. Thank you very much. Thank you very much. Have a great day. Bye bye.